Now, kidney stones, they can affect both men and women. And Dr. Martinez, you're up at our 3D monitor. Can you explain to us what kidney stones are, how common they are, and how they develop?
Absolutely. So what we're talking about here, this is the actual kidney right here. This is the organ that your body's used to filter out toxins from the actual blood. That will be turned into urine, which will then be collected within the middle of this, called the renal pelvis, go down this tube that measures about 24 centimeters usually, all the way down into the bladder. So this is the kidney, renal pelvis, ureter, bladder, which is the major parts that we're talking about when we're dealing with kidney stones. A stone is a calcification, or we'll say a nidus, because it sometimes is not made up of purely calcium. It can be made of also uric acid, many other things, that is created within the actual kidney. And then these things, which usually measure anywhere from 1 millimeter to 10 millimeters, will then dislodge and get stuck in this tube. And when people say, I have a kidney stone, what they actually really mean is a ureteral stone. If somebody comes in with pain, it's usually because the stone is stuck somewhere in here. And this is a very, very thin structure. It has about the gauge of a cocktail straw. So this is why something that can measure 1 millimeter can hurt. And so that's typically what we're talking about when we're dealing with kidney stones.
Now, Dr. Martinez, let's get down to the basics. So what is the function of the kidney?
The function of the kidney is to filter. So it will filter out all the toxins and bad things that we have inside of our body and turn that into urine for us to